In this video, I'm going to talk about the difference between Clinical Psychology Doctorates and Counselling Psychology Doctorates. The reason I'm making this video is because there's a lot of confusion around the differences and similarities between these two courses and the qualifications that they lead to at the end. So if you've done your psychology undergrad, that means you're eligible to apply for these courses. Now, in the UK, clinical psychology is free for anyone who is an EU citizen or a UK citizen. You can actually go onto a clinical psychology course, have that course paid for, and you get paid as well. You actually get a salary. Now, if you're an international student, you're going to have to pay a pretty hefty fee to do clinical psychology. So a lot of people's decision-making process as to which qualification they actually do, whether it be counselling psychology or clinical psychology, does come down to the financing. Because the courses are very similar, and I'll talk about the similarities and differences in a moment. But clinical is incredibly competitive to get onto. So clinical psychology is far more competitive to get onto than counselling psychology, because with clinical psychology, you're only allowed to apply for 3 courses in the UK. And because it's funded for a lot of people, not everyone, but all the UK and EU people, they're going to get a free course, a very expensive course that's paid for, and they get a salary. Although there's going to be international students paying for the course, because so many people get it for free, it's high in demand, it's so competitive, it's really difficult to get onto those courses. A lot of people do psychology undergrads, a tremendous amount of people do those courses. So the fight is pretty tough, long and hard for people who want to do clinical psychology. So my advice to people who want to be a HCPC registered psychologist, so essentially qualified psychologist who offers psychotherapy in the UK, is going to be, it's a numbers game, and apply for both counselling psychology and also apply for clinical psychology as well. The courses are tremendously similar, and the qualification that you get at the end of the day is tremendously similar. So regardless of which course you do, you're going to be a HCPC registered psychologist. Now, most jobs that are advertised for counselling psychologists or clinical psychologists in the UK by the NHS will accept applications from, regardless of whether you're a counselling psychologist or you're a clinical psychologist, you can apply. So if the job is listed as clinical psychology job, then because I'm a counselling psychologist, I would still be eligible to apply for that job because the role is so similar, the training so similar. But the key difference is that counselling psychology courses are always self-funded. Now, the other difference between the two courses is the neuropsych element. On some clinical psychology courses, there is a bit of neuropsychology training, but it's not really that extensive. You would still kind of need to go on and get more experience in that area if you want to really go into the neuropsych side of things further along down the line. And there's always exceptions. The counselling psychology course that I did, which was at Teesside University, actually did a little bit of neuropsych training, and they offered a little bit more neuropsych training than some of the clinical psychology courses. So even that thing about the neuropsych experience is not always a guarantee. However, in general, you'll probably find a little bit more of the neuropsych side of things on clinical psychology courses. So if you're particularly interested in neuropsych, then it would be understandable that you would be a bit more interested in the clinical psychology course rather than counselling psychology. However, the modules are incredibly similar. So on these courses, you're going to learn about therapy. You're going to learn a lot about cognitive behavioural therapy. You're going to learn about psychodynamic therapy, and you're going to get some experience and knowledge in other types of therapy, and you're going to learn about research. So predominantly, whether you enlist on a clinical psychology course or counselling psychology course, you're pretty much going to get the same HCPC psychologist training, psychologist qualification at the end of it, and you're eligible to apply for the same jobs regardless of whether you're a clinical psychologist or a counselling psychologist. Now, in private practice, the difference between counselling psychologists and clinical psychologists is non-existent. For example, at my clinic, private therapy clinic, we have a mix of counselling psychologists and clinical psychologists. And when we hire these people, we kind of notice which they are, but then we forget about it because they do the exact same job, regardless of whether they're a clinical psychologist or a counselling psychologist. The job they're doing and the clients they see is exactly the same. The only difference is that each individual can decide what they go on to specialize in once they become qualified. They can decide what courses they embark on as professional development. So that's where you get control and freedom over your working life, and you can decide in private practice what kind of areas you want to specialize in more so than others. So my advice to people who are considering training as a psychologist and doing one of the doctorates is don't get too caught up in whether you're applying to clinical psychology or counselling psychology. You just want to be a HCPC registered psychologist who offers therapy, if that's the career that you're dreaming of. Therefore, just apply to all the courses that you're eligible to apply to, because it really is a numbers game, and it's very competitive to get onto either of these courses, but it's going to be a lot easier to get onto counselling psychology because that's always self-funded. Everyone has to pay for it. Now, these courses are not cheap. So we're looking at about, different for different universities, but it's going to be about £10,000 a year if you're an EU or a UK citizen for the counselling psychology courses. If you're a clinical psychology international student, the fees are going to be even more. It's incredibly expensive to study clinical psychology at the top universities in the UK if you're an international student, and you don't get paid to do it if you're an international student, whereas the EU and the UK people actually get a paid job while they're also doing this really valuable training. So it can be incredibly confusing for people about what to do in terms of once they've done the psychology undergrad, and then they want to go on and they want to get onto one of these doctorates. What I would say is avoid doing any masters that don't lead to really good qualifications along the way, with the exception of the BABCP CBT course. Now, the BAB CBT course is either a postgraduate diploma or else a master's. You've got an option of doing it as a postgraduate diploma or a master's, and that takes about 2 years, a year and a half or 2 years to do that course, and that's a lovely course to do if you can get onto that course. However, it does require a lot of experience and a lot of psychotherapy experience before you're going to get onto that course. So you might need some extra courses or extra experience that you get before you go down that route. But in general, what I find when I advise undergrads of their career routes, people end up doing masters that they don't really need, that don't really help them, and don't really lead to them having a really solid accreditation. So really, if you have completed your psychology degree, and if you want to be a psychologist, just go for a course that is HCPC accredited, and then you will have a valid qualification in the UK as a psychologist. If you get this qualification in the UK, then you can transfer it over to work in other countries, which means that your transcripts would just have to be looked at, and then the course would be verified. But a UK doctorate that leads to HCPC accreditation is a very good qualification. Now, some people might have a special interest in forensic psychology or health psychology, and I would give slightly different advice to those people. But the advice I would give to people who are interested in the health psychology route is that it's a kind of a limited qualification if you go down that route. And if you actually just train in clinical psychology or counselling psychology, you can specialise in the health-related stuff and helping people with health-related conditions anyway. But it makes you more employable. You've got more opportunities to work in a wider range of difficulties and areas, because health psychology jobs may not come up all of the time. Forensic psychology and of course sports psychology are very different, so that would be different advice that I would give to people who are considering those courses. But the advice I most commonly give to people in relation to counselling psychology and clinical psychology is just they are very similar courses. And if it's your goal to get qualified as a psychologist sooner rather than later, I would say just apply to all of the clinical psychology and all of the counselling psychologists that you're eligible to apply to. And then once your offers come through, then you can see what you have, and then you can make decisions about whether it is really the course that you want to be going on to. Certainly the London courses are more expensive than courses in other parts of the country. The course that I did at Teesside University was amongst one of the most affordable when I did it, and it also came with a bursary in the first year, so that was really nice. I was also studying in a part of the UK that was incredibly affordable to live, so it was kind of beneficial to me. I got offered a place at Roehampton as well, but I felt that actually it was better for me to study outside of London just because of the finances that were available to me at the time. However, a lot of people are already based in London and therefore they don't want to be moving out. And for those people, I would say look at courses that might be actually commutable from London if you're based in London. Also, another thing to consider is that the clinical psychology course is actually more demanding in terms of lecture hours in general. And this will vary from course to course, but in general, counselling psychology is 2 days lectures a week. The rest of the days you're on work placement, and clinical psychology will often be a bit more demanding than that in terms of the actual lecture hours. So you might want to email the universities and just find out about exactly what time and day the lectures are on, what kind of commitment there is in terms of lectures, because that can vary amongst course to course. I'm going to talk about some of the modules that are being covered at clinical psychology courses and counselling psychology courses for people who are starting these courses this year. So I'll mention 2 counselling psychology universities in the UK, and I'll mention 1 clinical psychology course in the UK. So this is so you can kind of see the similarities and differences of the modules being offered at different universities. And this will kind of help you see the difference between counselling psychology and clinical psychology, and also the similarities. At Roehampton University, for people starting this year and then over the next 3 years, they'll be studying modules such as professional practice and development, person-centered and experiential theory, inclusion, ethics and social justice, assessment and formulation and clinical presentations, research, psychological knowledge and models of therapy, psychodynamic theory and practice, personal development, advanced competencies, CBT theory and practice. Then at London Metropolitan University, for people starting this year who are going to be doing the course over the next 3 years, or for part-time people it's over 4 years, they'll be studying advanced research design and analysis for psychology, counselling psychology practice and development, professional and ethical issues, psychological knowledge and models of therapy, research, project and critical thinking, therapeutic and reflective skills, working with difference and diversity, advanced psychological theory and practice. So now we've got the clinical psychology course at King's University London. They'll be studying adult mental health, including anxiety, depression and psychosis, psychology and psychiatric of childhood and adolescent, neuropsychological theory and practice, clinical psychology as applied to intellectual disability and neurodevelopmental disorders, mental health of older adults, clinical health psychology, forensic psychology, psychological therapy with strong emphasis on CBT, family therapy and mindfulness-based therapies, professional, legal and ethical issues, race, equality and diversity, and leadership. So just by looking at these comparisons, what I can see, like what strikes me really, is just the neuropsych difference between these courses. In general, these courses are covering things like CBT, psychodynamic therapy, lots of different theories, lots of different therapies. Of course, these modules have different names at different places because they can call these modules whatever rings a bell with them and whatever they feel describes it best. And you could be learning that module at one university and learning very similar things at another university, and the module might be just called something different. But in general, there is a little bit more of an emphasis on neuropsych stuff on the clinical course compared to those 2 counselling psychology courses. And there's a little bit of a focus, a small bit more on more serious mental illness, such as a little bit on psychosis and stuff like that. So we could assume that clinical psychology courses lean a little bit more into the slightly more complex mental illness, but also it all comes down to the experience that you decide to have after you graduate. Because once you graduate, you can decide where do you want to apply for in terms of your jobs after you finish your doctorate. Do you want to lean into more neuropsych side of things? Do you want to lean into more complex mental health? And definitely counselling psychologists can see very serious mental health. We can work with psychosis. We can work with schizophrenia and disorders like bipolar that would be considered more complex personalities. We might not necessarily receive a lot of that training and experience on our doctorate, but we've got a lot of opportunity to get experience once we qualify. And even the placements that people pick and try to get onto during their doctorate training can have a huge impact on what they end up going on to do once they qualify. And for anyone who's a really strong interest in neuropsychology and you end up on the counselling psychology course, but you really have a passion for neuropsychology, you can go on to do further training and professional development in the future so that you can actually go on to really specialize in that area. So rest assured, if you get a place on either a counselling psychology course or a clinical psychology course, you're doing very well. You've clearly worked hard to get there because it's very competitive. Your chances of getting a place on a counselling psychology course statistically are far greater than getting a course on clinical psychology in the UK. But if you're really passionate about becoming a psychologist, just really go for it in terms of getting onto one of these HCPC accredited courses. Get the right training and experience, get the right work experience beforehand, get a little bit of client experience in whatever capacity you can, even if it's just support work, and then you will be in a really good position to be a strong candidate when you're applying for these kind of courses. So if you've got any questions from this video, just write a comment below and I'd be more than happy to offer some extra advice.